Welcome to our explainer, where today we're breaking down one of the most common surgical conditions in the entire world, the inguinal hernia. We're going to get straight to the point on what it is, how you find out you have one, and how it gets fixed. Let's kick things off with a number that might surprise you: 27%. That is the lifetime risk for men to develop an inguinal hernia. For women, it's quite a bit lower, around 3%, but you get the picture. This is a super common issue. So to really get a handle on this, we're going to follow what it's like for a patient. We'll start with, what exactly is a hernia? Then we'll walk through how it's diagnosed, the whole history of how we've treated it, what the options are today, and of course, what life is like after it's fixed.
All right, first things first. That unsettling bulge, what's the deal with that? To understand it, we've got to take a quick look at our basic anatomy.
Okay, so just imagine your abdominal wall is this incredibly strong muscular container, right? Its whole job is to hold all your insides, well, inside. But here's the thing, this container isn't perfectly sealed. We all have this natural little tunnel running through the wall. It's called the inguinal canal. In guys, this is where the spermatic cord passes through, and it basically creates a built-in weak spot.
So, an inguinal hernia, that's just what happens when some of your internal tissue, like a bit of intestine, finds that weak spot and pushes its way through. And that is what creates the bulge you can see and feel.
And, it turns out not all hernias are created equal. They're actually classified based on exactly where they pop through. An indirect hernia, that's the most common one, it follows the natural path right into the canal. A direct hernia, on the other hand, just kind of busts straight through a weak part of the muscle wall itself. A little different.
Okay, so let's say you've noticed this bulge. Now what? Let's talk about getting a diagnosis and how a doctor figures out for sure what's going on. For the most part, getting diagnosed is surprisingly simple. It's usually just a physical exam. The doctor will have you stand up, they'll feel the area, and then they'll ask you to do the classic turn your head and cough. That cough just increases the pressure inside your belly and makes the hernia pop out, making it really easy to spot. But what if it's not so obvious? Well, that's when we turn to imaging. If the hernia is tiny, or if the patient is overweight and it's hard to feel, or maybe the doctor just wants to make sure it's not something else, an ultrasound or a CT scan can give a crystal clear picture of what's happening. So, you've got the diagnosis. The next big question is, what do you do about it? And you might be surprised to hear that the answer isn't always rush to surgery. This quote right here really nails a huge shift in how doctors think about this. We've learned from years and years of research that if a hernia isn't causing any pain or problems, just watching and waiting is a totally safe and actually recommended option.
So it really comes down to this trade-off. If there are no symptoms, you can safely wait. The data shows that most people, about 72%, do end up choosing surgery eventually. But you can wait. On the flip side, if it's painful, then getting it fixed is the way to go. That's to avoid a really dangerous emergency called strangulation, where the tissue gets trapped and its blood supply gets cut off, and you do not want that.
Now, for everyone who does need surgery, the way we fix hernias has gone through this incredible transformation. It's a really cool story.
Just look at this timeline. It tells the story of over 100 years of surgical progress. We started way back in the 1880s with repairs where surgeons would just stitch tissue together. The problem was it was under a lot of tension, so they failed a lot. Then, fast forward a century to the 1980s, and we get the Liechtenstein repair, a total game changer. The big idea was using mesh for a tension-free patch. And that changed everything. And then, of course, the 90s brought us into the minimally invasive era.
So all that history has basically left us with two fantastic modern ways to think about this. You can either fix it from the outside in, or you can patch it from the inside out. The first way is the open repair, what we call the Liechtenstein repair. It's still the gold standard around the world. The surgeon makes a cut right over the hernia, gently pushes the tissue back where it belongs, and then places a special mesh over that weak spot to reinforce it. It's pretty much like putting a super strong patch on the outside of a hole. Now the laparoscopic approach, that's a whole different ballgame. The surgeon makes a few tiny little cuts and works behind the abdominal wall. From there, they place a big sheet of mesh that covers the whole weak area from the inside. The best analogy I've heard is it's like patching a tire from the inside. The body's own internal pressure actually helps hold that patch firmly in place.
And this table does a great job of laying out the trade-offs. With the scope, the laparoscopic repair, you're generally looking at a quicker recovery and less pain. But listen, the open repair is still an absolutely fantastic and super reliable operation. They're both great options. It really just depends on the person and their specific situation.
Okay, surgery's done. What's next? What do patients care about the most? It's the long-term stuff, right? Is this thing gonna last? And what are the potential downsides?
Let's go back to another number, 0.2%. Think about that. In a huge study looking at the modern Liechtenstein mesh repair, that was the rate of the hernia coming back. It's incredibly low. It just goes to show you how successful and durable these modern repairs really are. Now look, no surgery is 100% risk-free, but this chart helps put things into perspective. The most common things you see, like a seroma, that's just a little fluid collection under the skin, they're minor, and they go away on their own. The more serious stuff, like long-term pain or the hernia coming back, it's just not common with the techniques we have today. So let's wrap this up. What should you take away from all this?
First, inguinal hernias are super common, but they're also highly treatable. Second, watchful waiting is a perfectly safe plan if you don't have symptoms. Third, that modern mesh repair has been a revolution. It's dramatically cut down the chances of the hernia ever coming back. And finally, both open and laparoscopic surgery are great choices. They just have different recovery journeys.
And that kind of leaves us with one last big thought. We do millions of these successful repairs every year. The techniques are so good, they're nearly perfected. So is the next big frontier not about fixing the hernia, but about preventing it from ever happening in the first place? Maybe the real challenge now is figuring out the biology of why these weak spots give out to begin with.